Okay, hello everybody. I'm Rosie, I'm your instructor, and I just wanted to do a quick little video for success going over some commonly used veterinary medicine and kind of the categories you'll see them in. So the first one I'm going to work on is stomach upset meds. Obviously you're going to know Cerenia. This is a game changer. We love Cerenia in veterinary medicine. It works really good not only for motion sickness, but for if they're sick, say they have pancreatitis and they're nauseous or anything like that. It comes in both tablet and injectable form. An injection can go sub-Q or IV. So, Cerenia, it is not used in human medicine. Now, famotidine, this is Pepcid, comes in a bunch of different milligrams. So you can get this over the counter, but you can also get it, obviously, from your vet. This helps reduce the stomach acid and can help when they have sour tummy or if they're nauseous or they're generally upset, once again, for pancreatitis. There's other ones like Zofran, which is ondansetron, you can use. There's also metoclopramide, which can help. But I don't have those bottles. So, all right, and then I'm going to move on to antibiotics, which is another category you will see a lot. I'm trying to see if I can maybe adjust. Maybe that looks a little bit. Okay. Cephalexin. This is a really good antibiotic. It's often used. So when I speak about this, I'm going to speak from my experience. Obviously, I'm not a vet, so I can't speak to that part of it, but I have seen cephalexin used for a lot of things, but a lot of times it's used for skin issues. Now, when you're pulling antibiotics, you need to, any medicine really, you need to make sure that you're checking the milligram because you could kill an animal if you don't. I have some sayings I always say. Don't assume, ask, because this is life or death, right? They're never going to be mad at you for asking. They're going to be pissed if you assume. Something that could kill a cat would be fine for a dog, so you really just need to double check. Taking initiative, asking questions is going to take you a very long way in this career. So, cephalexin is great. Cefpodoxime is another one. I saw this prescribed a lot for puppy pyoderma, or puppy pyo, which is just a minor skin infection they get, but also used for skin. Clavamox, we love Clavamox. It comes in both a liquid and a tablet. The tablets are annoying because they're like sheets, right? So you can't just throw them in a bottle, you send them home in the sheet. It's actually amoxicillin and clavulanate combined, but we just call it Clavamox. There's a human version of this, but I don't remember what it's called. So that could be a fun little pop quiz. It comes in a bunch of different milligrams, of course. Use it for a lot of different things, but I often saw it used for upper respiratory and urinary tract infections. Clindamycin. Clindamycin is a fun one. Again, you can use it for a lot, but it does often get used in dental procedures. Like if they have a really yucky mouth, like full of plaque and tartar, you can use it for that. You can even do pulse therapy. So if they have a really disgusting mouth, some vets will prescribe this as 3 weeks on, 1 week off, just to help get rid of all that bacteria and crap in their mouth. Because a dirty mouth, it may not seem like a big deal that their teeth are dirty, but all that plaque and tartar is bacteria. And that can get into the bloodstream and cause liver, kidney, heart issues. So it is really important to have dental health. And clindamycin can, obviously it's not going to get rid of it, but it's a great way. If they had a really nasty mouth and you did a dental cleaning, because it's going to put some of that in the blood. Okay, this is the same thing as Clavamox, just not branded. So, I've actually never seen this before, so that's cool. But it does happen. Baytril. Baytril is also enrofloxacin. It is a heavy hitter antibiotic. It's not something you just prescribe lightly. It can also cause joint and teeth issues if you prescribe to dogs that are too young. So it works really well, but it's not, we want to, in general, medicine wants to be choosy and protective of their antibiotics, because if you just throw antibiotics at everything, then eventually we will create a superbug, and that is no bueno. So Baytril is a heavy hitter. We'll use it for a lot of things, but I would often see it used when a patient has a rod bacteria infection or just a really bad infection. And doxycycline, another really good antibiotic used a lot. With canine bordetella, it can have viral, fungal, or bacterial causes. So often I would see this prescribed with kennel cough. in case it was bacterial, but it also is used a lot in tick-borne disease treatments. Like Lyme disease dogs will get doxycycline, or Ehrlichia dogs will get doxycycline. Again, I'm not a vet. This is just what I've seen. I'm prescribed. It's a good one. We're like, okay, moving on to another category. NSAIDs, non-steroidal anti-inflammatories. We love it. Cats can only take very specific ones. Their cats are finicky. One that is specifically for cats is called Onsior. I believe they have an injectable version, but they have a pill you can send home with the owner, because we really shouldn't send shots home with the owner. That's not a good recipe for success. We also, I believe Metacam can also be for cats. I know it's used on dogs. I believe it can be for cats. Metacam is meloxicam. This is from what I understand, a veterinary specific medicine. Again, I don't know anything about humans, so I could be wrong. It comes in both a liquid and a pill and injectable form. So this is really good. We use this a lot for like post-spay, post-neuter, send it home. Post-dental if they're in pain. Now, this is something to keep an eye on. Remember how we talked about brand name versus drug name? These may look different, but aside from the milligram, they're the exact same medicine. You see how it says carprofen? Carprofen? They're both carprofen, which is a very good, they just have different brand names, Rimadyl and Novox, which is a very good NSAID. Very commonly used, very good NSAID. Use it for a lot of things. Post-ortho surgery, general aches and pains, post-surgery. It's a very good one. Something fun to think about is that a lot of these pills are flavored, okay? Well, what happens if the pet is allergic to chicken and it's flavored with chicken? What do you do then? Same with prevention. Just something for you to chew on. And then here's another one, Deroxicab. This one I don't have much personal experience with, but Deramax, it's just another NSAID used. Cats. Do not use it cats, only for dogs. Okay, moving on once again to ears. Whenever you're cleaning ears, whenever you have an ear infection, you're gonna get a sample before you clean it because you wanna make sure you can see what's actually in there. Then the doctor is going to check to make sure the eardrum is intact, because a lot of medications and cleaners will ruin or cause damage to the eardrum if they're not intact. So once all that's done, you can clean the ear. You're going to clean it. There's a bunch of different types of cleaners, but here is one. It's called Clear-Otic. We used one called EpiClean a lot, or Epi-Otic. These are not just like liquids. They have a drying agent in them, so they help dry out the moisture, because bacteria and fungus love warm, wet things, which is what an ear canal is. Usually with an ear medicine, it's not going to be a pill, it's not going to be injectable, it's a topical. You put it directly in the ear. Memetamax is a big one. You can use it on dogs and cats. Surlan, relatively new, you can also use it. These both need to be applied twice a day, okay, which is kind of a pain in the ass, because generally if you haven't, pain in the butt, because generally if you have a ear infection, it's gonna hurt. There's also one called Claro, which I love. You have to clean it really well, and it's a liquid medication that you put into the ear, and it lasts for 1 month. So then you don't have to do medicine all the time. But it is a bit stronger, so they don't always like to go for that. Again, in veterinary medicine, you do have to, lifestyle matters, right? My cat Joe, there's not a chance in this world he would let me get in his ears twice a day. But my dog Luna, she would be fine with it. So you have to kind of go like that. Though technically, Claro is not approved, FDA approved for cats, so it is off-label use in cats. Another fun thing to think about. Okay, heart medicine. All right. A lot of times heart medicine is just going to work to support the heart. Or pull off extra fluid. The main ones we use, enalapril. I see these prescribed a lot. Benazepril, okay, and Vetmedin, which is Pimobendan. Usually they also prescribe a diuretic, which pulls off extra fluid, because in congestive heart failure, your body is, fluid is escaping. There's too much fluid and you have to pull it off. Lasix or Salix, it's furosemide. This also has an injectable. I'm not a cardiologist, so I don't know too much about it. But steroids. This one is really cool. These all come in injectable as well. But prednisone is a big one we use. We love prednisone, but it is only for dogs. It is not for cats. Okay, cats cannot process prednisone. Cats have to have prednisolone. Do you see how similar these look? Do you see how easy it would be to mix up and grab the wrong pill if you're not paying attention? There's a reason why this matters, even if it seems really trivial. Because cats can't have prednisone, they can only have prednisolone. So, another one we use a lot is Dex. We love a shorthand of Batman. But dexamethasone. It's an injectable steroid. Okay. Moving on. We're going to move to our endocrine drugs. Metabolism drugs. Thyroid. Cats get hyperthyroid. Dogs get hypothyroid. Purr for cats, purr. So for cats, you're going to need to give them a pill that boosts, that brings down their thyroid, and for dogs, you're going to need to give them a pill that brings it up. Dogs often get this. Thyroxine, it's levothyroxine, right? Thyroxine, but there's different brands, right? So that's Thyroxine L, this is Soloxin, another common one is Thyrotabs. Again, you gotta read. And they're gonna have different milligrams. It's usually in points, like 0.4, 0.2, 0.1. So, another important thing to pay attention to, because you don't want to give them the wrong dose. These need to be given twice a day, and when you're checking their blood levels, you need to do it like, they need to be giving it regularly, and I believe it's 4 hours after they give it. So, could be wrong on that though. Now, we've got our, I'm sorry. And this one is for Cushing's disease. Trilostane, right? But the brand name is Veteril. This stuff is super expensive, but it works. It helps control the Cushing's. They feel a lot better. I've had 2 dogs on it. It's like $100-something a month, but it really is the gold standard for Cushing's in dogs. So I imagine if you have a horse, it'd be very expensive. Okay, itchy dog. There's lots of different options for itchy dogs. Old school, or at least in my experience, the vets that I worked for that were older school would prescribe this Timarol P, which is like an antihistamine type medicine with steroid in it. So it's not like the main one they reach for, but you can use it in situations. Hydroxyzine, while it does work for anxiety in humans, is technically an antihistamine, so they do prescribe it for itchiness. You can also, Allerchlor, chlorpheniramine is good in cats. That's an over-the-counter drug. Obviously, talk to your doctor before you use it. But Benadryl doesn't have as much effect as you would think. It doesn't work as well. And Apoquel, this is a newer type of drug that works really good for itching, usually for allergies. It's a pill, you give it twice a day. It is super expensive, but it works very good to control their itching. Now, there is a unique side effect that it can cause them to be more aggressive, so something to keep an eye out on. There's also an injectable version of this called Cytopoint that lasts for a month, so you don't have to give a pill every day, because some dogs are impossible to give pills to. And my final category is these appetite stimulants. Usually, I'm so sorry. This is methimazole, which is actually a cat thyroid. I'm sorry, it's not antihistamine. See, even I make mistakes. Fluimazole or methimazole is the thyroid suppressant for cats. They also make it in a transdermal version, which is where you can put, wear gloves, of course, but it's an ointment you put on their inner ear flap, the pinna, rotate ears every time you do it, and they can absorb it that way. It's not as effective, but for cats like Joe, who won't take pills, it could work. So I apologize that one was out of order. See how easy it is to mess it up? Because the one I was looking for is called methimazole. No, I'm sorry. It's called mirtazapine. Mirtazapine is an appetite stimulant that we use in cats, and cyproheptadine is one as well. That is a quick and dirty little review. So if you have any questions, let me know. Thank you.